Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And we're going to talk about something that you've been writing to us about. We have a lot of folks that, as I was just saying to our guests, my mom, God bless her soul, lived to be 92, and she never allowed me to call her old or a senior citizen. She always said, I am a mature citizen. So we have a lot of folks that watch us that are out there active, participatory. As I always tell you, we have a great viewing audience. So we have two people that are going to talk about the issue of senior services and geriatrics. We have a geriatrician here. That means a doctor who specializes in geriatrics. So let me first introduce Donna DeFronzo, right? DeFranco, right? I'm sorry.
Donna's fine. Donna DeFronzo.
DeFronzo. I apologize. I can't read the teleprompter, all right? My eyes are getting mature. And she's a director of senior services at the Northeast Focal Point Center, which is a wonderful, wonderful facility in Deerfield Beach, right?
Correct. Thank you, Dr. Lippman.
Good. Good
It's
to
my
have
pleasure
you.
to be here today.
Thank you. And one of our new superstars here at Nova Southeastern University, Dr. Kenya Rivas, who is with our Department of Geriatrics in our College of Medicine at NSU. She deals with the geriatric patients, along with our wonderful Dr. Nashira Pandia, who is the director of our department and chair. And she does preventative measurements in geriatrics. And we're going to talk about that. Dr. Rivas, thank you.
Thank you. The pleasure is mine, Dr. Lippman. And yes, we're going to talk about mature preventive measurements.
Right.
That's what we're going to call it. Yes.
Well, you can call it anything you want. It's just that I had to throw in that anecdotal event. My mother she's looking down and she would really hit me.
No,
if
I
I
think
didn't.
she's proud,
Yeah.
very proud. Well, I just wanted to, bring the opportunity to speak a little bit about, prevention and or senior or geriatric patients or mature, population. Why? Because this is a very complex area as we are growing older. We have several features that will, actually make it very interesting. We know that the major leading causes of death in the United States are cardiovascular disease, we have cancer, cerebrovascular disease, diseases related with the lungs, also. And we have Alzheimer's at the 6th and diabetes at the 7th, and all of them are more or less related with health style, right? Or life choices. If we smoke, if we choose a very poor diet, or we're not enrolled in any physical activities. We know also for a fact that those diseases also could be modified by our, actually choices. That's why it's so important for us to counsel our mature patients in regard to smoking cessation no matter what. That will prolong their life despite of their age. Also to introduce, healthy diets like Mediterranean diet. Have you heard about that?
Yes.
Yeah, just like an antioxidant, it protects your cardiovascular system. It's based on nuts, berries in general, salmon, tuna, etc. To be involved in aerobic activities and also, weight-bearing exercises that will actually prolong the life of our bones. And going and changing gears into cancer screening is very important. However, if it would be futile if life expectancy for our patients are no longer than 5 years, and that is self-explanatory, right? When we talk about cancer screening, we mention breast, colon cancer, prostate cancer, and later lung cancer via the low-dose computed tomography. However, I have to mention that, our treatment and preventive measurement will change based on patient individual conditions. Life expectancy based on medical problems. Also, if the patient is functionally well, is capable of doing their activities of daily living, the ones that imply survival. They can transfer from the bed to the toilet, they can eat and group themselves, so on and so forth. Or short-term goals of geriatricians are preserve health. The midterm goals are basically to increase or maximize functionality And the long-term goals are to engage these people in, joyful activities and preserve them and keep them at home as much as we can. And talking about, a joyful and, good activities, I just wanted to touch bases about, Focal Point. This facility, I think, provides with wonderful activities to our senior population.
Okay, well, let's get into that. And thank you for your presentation to open up the show. But may I call you Donna?
Certainly.
Sure. Donna, explain to the people what a Focal Point Center is.
Basically, the Northeast Focal Point, and there happens to be 4 focal points in Broward County. The Northeast Focal Point, as well as the other focal points, serve as a one-stop shopping, which is a comprehensive array of supportive services for individuals. As Dr. Rivas has described, the goal is to maintain an individual's independence, improve their quality of life, and engage them within the community. At your local senior center, you want to celebrate life. Life, we use the acronym LIFE, learn. Learn and expand your knowledge. I for independence, to keep you independent and active as long as possible in the community with the supportive services that we can provide. And then F for friends, to develop friendships. As they continue to age, they lose significant others in their lives. So we want to develop friendships among their peers as well as with individuals of all generations. In addition, energy for E, enrich their lives through vitality and health prevention type activities and programs, as well as screenings.
Let me ask you, because I do have some integral knowledge of focal point centers. I guess we responded back in the early 80s, 1980s, to the tremendous growth of our senior population, our mature population. The policymakers decided that we needed some venue to provide one-stop shop, as you're saying, for senior services. And I think that they've been dramatically successful, especially with the fact that the state of Florida has the largest percentage of people. I mean, first I used to say over 65, now it's over 75, now it's over 80 of any state in the United States. I mean, we are 10 to 15 years ahead of all the major population areas with reference to lifespan. But with lifespan comes a responsibility. Correct. So if we want to be good citizens and we want to take care of moms and dads and aunts and uncles, we have to provide them with services or opportunities to get services. That doesn't mean free. It means obligate ourselves as a society to provide services. That's what the focal point centers are, correct?
Absolutely, you're 100% correct, Dr. Lippman. The Northeast Focal Point was established in 1981, again, to provide the supportive services to dispel social isolation, to help with loneliness and hopelessness and helplessness that seniors were experiencing. They could come to the center. Transportation, as you mentioned, is one of the #1 needs for seniors in Broward County because they need accessibility. Accessibility to the focal point, accessibility to the doctor's appointments, accessibility to grocery shopping and other types of shopping, accessibility for various entertainment field trip activities. In addition, there's a registered nurse who provides health and wellness type programs, particularly along the lines of prevention measures in order to improve an individual's health and well-being. As you know, the World Health Organization's definition of health is physical, mental, and social well-being of an individual, not just the absence of illness or disease. So in addition to health support, registered nurse that we have for health screenings, various health lectures, we mentioned enhanced fitness type programs and yoga programs and a variety of activities of movement in order to keep somebody as independent as possible so that we can delay premature institutionalization. We also have a licensed mental health counselor that provides both individualized as well as group counseling sessions, again, to improve and have older individuals be able to cope with some of the changes that they're experiencing as they age.
Well, again, to both of you, lifespan is expanded.
Absolutely.
Yes.
But lifespan is not that valuable without quality of life.
Right, indeed. That's true.
And the issues related to geriatrics, and it's really amazing to me that for many, many years, many medical schools around the United States were not providing the education and the training for geriatricians and people who specialize in geriatrics. You're board certified geriatrician, and when you speak of healthcare, you're talking about the composite nature of healthcare, which everything is from traditional doctoring to mental health to nutritional health to even some counseling, correct?
That is correct, exactly. So we're trying to counsel on everything, and we actually, we are lucky to be here at this university because in our clinic we have pharmacist students and psychologist students, and we're trying to take advantage of them when we're seeing our patients. If the patients have, some psychological issues, coping with, recent movements or grieving, their partners that recently died, they come into place to help us. And pharmacists students also are helping us with management of polypharmacy because the less medication, the better, less side effects for our patients. It's kind of cumbersome and complex to treat our geriatric patients. And but as I told you, our goal is to improve and increase their functionality, to trying to not to disappear diseases because that won't happen, but at least to make them more functional and to enjoy somehow that stage of their life. And that's why I love, actually the concept from you guys, from Focal Point. I think that will help, and I wish we would have more for them to go and to understand that, okay, aging is part of the process, but also we can, find joy at that moment as well.
I tried not to editorialize, but this is going to be a little, I'm going to ask you as a licensed medical professional who is board certified in geriatrics, I will tell you that over the years in the state of Florida, one of the most successful advocacy groups in medicine has been pediatrics. And the reason is because people have a tendency to say they want to protect our children. And everything that you hear is about the child being taken care of, being delivered correctly, having proper nutrition, etc. I just wonder if your fellow geriatricians would be willing to be a little more, and maybe this is unfair, but a little more public about their needs for the largest quadrant of our population, and which is really, we are the paradigm for the rest of the United States.
Yes.
I mean, we are the place where geriatric medicine should function efficiently, equitably, and pleasurably for the patient. Am I saying something that's inadequate?
No, it's true. I think, in regard to pediatrics, it's because it's the future of the nation. But what about geriatrics? So we have the right to age, with quality as well. Why do not, actually, as you say, to trying to expand more the education towards, the healthcare force and people in general to trying to improve that quality of life and health in that age. And we are becoming bigger and bigger. And actually, as you said, Florida has a huge amount of, geriatric patients or mature patients, indeed. Also, I think, economics plays an important role. Knowing, your resources, your rights, sometimes they don't know it. So they may have Medicare, Medicaid, but they don't know what, rights or what, services they could, have for them to improve, their life in general. So that is part of the education that we should continue giving.
Yeah, but that's why this continuum of relationship with places like the Focal Point centers, and there are other units of service through United Way and otherwise that are supportive of senior services. But it seems to me, Donna, that if there was more of a involvement and maybe this is unfair because I know our geriatricians work very, very, very hard. They are the cornerstone of retirement communities, that are the cornerstone of the extended care communities and nursing homes, et cetera. They are. I mean, without them,
Absolutely.
I mean, it's gone. But I'm just wondering whether there could be some closer relationship in an advocacy perspective, because the people that you care for, that you love, that you hug, because I know what goes on in focal point centers. A lot of hugging in focal point centers.
A lot of love.
A lot of love. And it would seem to me that somehow when you listen to the policymakers, and I don't care which, what party they belong to, whether they're conservative, liberal, or whatever, they all talk about the greatness of this country, but the greatness of the country lies in the repository of the people who are living at 75, 80, and 90 years old. They're the ones who have made this great nation what it really is. Go ahead.
Absolutely, Dr. Lippman. The older population is the greatest generation. Their wisdom, their life experiences, they have so much more to offer than what we give them credit for. And as you know, the value of character of any nation is how they value their most vulnerable populations as well as their aging populations. And you bring up a much valid point as it relates to the fact that we haven't valued the older population within our society. We have a fragmented long-term care system. Fortunately, Dr. Rivas is here as a geriatrician, and Nova has a fabulous program here to outreach to the various senior centers and community organizations within Broward County. However, we don't have enough. But I think your point of us combining together to advocate at the political level would be well served for the aging populations, as well as the fact that older individuals, or mature adults as we would say, are great advocates themselves. And they contribute so much more to the society than what they take as it relates to supportive type services that focal points or community centers provide. We have done a disservice to them. And as the population continues to age, we really need to focus our efforts like we have for children and other segments of our population, because they are valuable members of society and need the support and love, because we also know that it's less costly if they go to a community center or a senior center with supportive services than to place them in a nursing home or even an assisted living facility, or where it could be $60,000 to $70,000 a year to provide that quality services. But at the same time, we're diminishing their activities of daily living, their instrumental activities of daily living, because we're not providing health prevention, health promotion, and health wellness at the level that we really need to be. We do the best that we can for the population that we serve, but additional resources, financial resources particularly, would be so much better served in the long run as it relates to cost savings for our nation as well as our state.
And I can only tell you that if we would start to think about more investment in providing information, communication,
Education.
Collegiality, it's all part of that education process. And that's what the focal point centers are all about, and that's what you must learn as you become a geriatrician. I mean, why would you, instead of becoming a pediatrician, instead of becoming a neurosurgeon, instead of becoming a cardiovascular surgeon, you decided that you want to take care of, in quotes, the elderly, the seniors, the mature individuals.
Right. As I told her, it brings me a lot of peace and joy, number one. I feel like I was born to do it, in few words. I love when I'm interacting with them, when they are teaching me their wisdom. Why did they reach that age and looking that well? Or for those that aren't, because of their life, choices. I'm learning from them as well how to educate the rest of the population and myself of what not to do. Also because we are so few, we're not that many. So I want just also to expand the word. And in our department, you mentioned, our dear Dr. Pandia, but also is Dr. Haynes, Elizabeth, and Dr. Masri, and we are all, passionate about our field, and we would like also to continue expanding and giving a lot of education and, counseling to our population indeed.
Well, I give a lot of credit to our founder, Dr. Morton Terry, because he insisted upon us having geriatrics as part of our clinical, I guess you could say, delivery services here at Nova Southeastern University. But he also demanded the hiring of board-certified geriatrics physicians, geriatricians, because he felt that, and this was back in, the mid-'80s, he felt that the state of Florida is going to need that type of health care. And he, being an internal medicine cardiologist, he saw that. He was a visionary, and we want to enable our geriatric physicians, who are wonderful, or everyone that you mentioned are wonderful. I want them to be able to be available. I want them to be available to the condominium associations, to the homeowners associations, to the chambers of commerce, because that enables the people out there to know that there is such a thing as the focal point centers.
Absolutely, and that is ultimately our goal, is to improve their quality of life, encourage and have them to continue their independence, and have them be engaged in the community, whether it be through transportation service, health support services, counseling services, recreation, activities, both mentally and physically stimulating activities, to, again, keep them independent and well for as long as possible.
Let me ask a question. How old is your oldest?
We say we serve from 2 to 102 because we have an on-site child care center from 2 to 5. Right now, our oldest is 103 years old.
Yeah,
Our average age is approximately 78 years old, although we serve 60 years old and over.
Right, right.
In addition, we have an Alzheimer's daycare center for individuals who have Alzheimer's disease, some form of dementia, as well as memory loss, and we provide supportive services for the caregiver, along with physically and mentally stimulating activities for the individuals that have Alzheimer's disease.
Yeah, well, that's another, I know you brought it up, but I really think that needs a whole program to talk about dementia and Alzheimer's, because I really think that over the next 4 to 5 years, there's going to be a dramatic medical research and discoveries relative to cognitive disease issues. We're down to the last 2 minutes of this show, so I'm going to have to, get to the point. I'm sorry that I started to express my own advocacy, but, sometimes it oozes out. I can't help it.
It's very important, very, very important.
Yes,
But I always tell the folks that watch us that it's very important for them to communicate with their doctors what is wrong, what is bothering them, and what medications they take. They take all kinds of over-the-counter medications, nutraceuticals and otherwise. They have to let their doctors know. They can't say, I've had this pain for 6 months and now I'm showing up because it's intractable. They need to come to speak to your doctors. It's not going to be of any more cost to you to be and see your doctor early before they have problems, correct?
That is correct, and thank you for your words, and I very much will appreciate the audience to understand that, and we are open for them and happy to serve them.
Okay, so you have full clinic hours here at NSU.
Yes.
It's in the San Fidel Ziff building, which is on 40th and University Drive, correct?
That is correct. First
Right.
floor, yes.
Right, and where's the Northeast Focal Point Center again?
It's located in Deerfield Beach, 227 Northwest 2nd Street. You can give us a call, 954-480-4449. We'd be more than happy to assist you with any needs that you may have.
Well, I salute all the Focal Point Centers. I think they're wonderful operations. They're not for-profit organizations. They provide an incredible amount of service opportunities to help the folks that are out there have a more independent and kind and loving life. I mean, I don't know what else to tell you, but that's what I see out of the Focal Point Centers, and I'm sure that you see the same thing when you interact with the Focal Point Centers.
Oh, indeed,
right?
absolutely, yes.
Right. So thank you both very, very much for being here.
My pleasure.
Thank you, Dr. Lippman. It's our honor.
No, Donna DeFronzo, right?
Yes.
Right, that's right. And from Boston, too. I mean, it's a good family from Boston.
Absolutely.
And thank you very, very much for being here. And like I said, the Northeast Focal Point Center has been a diamond that we've cherished for quite a while. Thank you very much.
Thank you
And
so
it's
very
our
much, Dr.
pleasure.
Lippman.
Thank you for the invitation.
And thank you, Dr. Rivas.
pleasure.
We're very proud to have you join our Department of Geriatrics. And you have wonderful colleagues. And folks, if you want either of these folks to show up, or some of their surrogates to show up at any of your homeowners meetings, condominium meetings, whatever it might be, just we're gonna put all the telephone numbers down. Just give them a call. That's what they do. They provide information to help you help yourself.
Thank you for your kind words. Yes, indeed, please. 954-262-4100 for geriatrics.
Got it. We're going to put it up anyway. This show comes to you from Nova Southeastern University, and this show is called Dateline Health. And my name is Fred Lippman. Until next time, see you.